nursing faculty. And I still spend a lot of time with those students and with those roles and just trying to spread the word of all the awesome opportunities we have for nursing students and nursing graduates at Union. But you know, just the way it's gone with the pandemic and our increased openings, I help with pretty much everything. So whatever your interests are, whatever you're looking for, I left my card back there, and if I can just help get the conversation started, whether or not that leads to a job at Union, if we can help at all with the path that you're looking for or the journey, if you have no idea exactly what you're looking for, we'd like to help you too. If there's anything we can do to help you that might in turn help our community, we're happy to do that. Selfishly, we'd love for that to be at Union, but if it's just helping you with your path and that leads you somewhere else, that's okay too. If we can just assist you in any way, we're happy to do that. And it's okay to not know exactly what you're looking for. You know, everybody's situation, interests, career path could be totally different and individualized. So again, after tonight, if there's, you know, hopefully we can answer all your questions. If not, please reach out to me. And we've just got a great team at Union with a lot of people with very diverse backgrounds and paths themselves. So if we can help you in any way, we're just so happy to do that. Thank you.
All right, we'll jump on over to Tracy.
Do you want to try one of the online people to check your sound?
Sure, that's an excellent
Because if it
idea.
doesn't work, then I can blab while you fix.
Okay, Brittany, why don't you go ahead and introduce yourself and tell us a little bit about your kind of career path.
Hi, good afternoon, everyone. Good evening.
Hold on.
Yeah, that was my concern.
Okay.
Hold on, Brittany.
Okay.
All right, Trey. Okay, go ahead and try again, Brittany.
All right. Can everyone hear me?
Better, yes.
Okay,
better.
awesome. All right. Good afternoon, everyone. My name is Brittany Black. Currently, just a little bit about myself. I did graduate from Indiana State in 2017 with my bachelor's in health science with a concentration in psychology. And then in 2019, graduated with my master's in public health. Master's in science with a concentration in public health. So I currently work for the Chicago Department of Public Health, and I oversee the vaccination outreach for the city of Chicago, primarily with our homebound program. So pretty much all areas of the city. Specifically, we have providers that go out and do vaccinations to patients in their home. They do not have to be homebound patients. It could just be anyone that just specifically don't want to go out and want us to come into their home to vaccinate them. So we do that consistently across the city. It's pretty interesting. As of right now, we have these surges where, as you guys know, we just came off a surge of Omicron. So consistently, we're just kind of having these up and down surges, but it is very, very, very rewarding to get out there and vaccinate all of those that are wanting to be vaccinated. So it's a little bit about myself. If you have any questions, feel free to ask me. I'll try and answer to the best of my ability.
All right, let's bounce over to Tracy.
I am Tracy Startzman. I currently work for Roche Diagnostics. I am a clinical research associate, and really all that means is I run clinical trials. So every product, everything, every instrument that goes on market has to go through a clinical trial in order to be proven safe and effective for the public. But I graduated, and we are not going to talk about what year. It's been a minute. But I graduated with a bachelor's degree in clinical laboratory science and a minor in chemistry. And then I got my master's in business when I decided that I wanted to not stay in the lab, but get out of the lab. My actual first job was at Union, so good place to work. Then after my master's degree, I got a teaching certificate. I'm a medical technologist by trade. Then I passed my certification for the CCRP and then for the PMP. So I am a research professional, and a project manager. So, and none of those I paid for. So if you want education for free, come talk to me.
All right, Wendell.
Hello all, thanks for joining tonight and giving me this opportunity. My name is Wendell Kirkman. I graduated in 2018 and then went to grad school for a master's in public health, and then graduated directly into a pandemic, which was probably the best thing that could have happened for my career. Made getting my first job quite easy. And so now I am an epidemiologist and senior data analyst for the state of Wisconsin Department of Health Services. And I work specifically on the COVID testing side of things. So Brittany does vaccination, I do the testing side. So that's pretty much the two sides to the response, I would say, in a lot, if you had to break it down. And so I do a lot of data analysis specifically with our school testing. And so, for example, today, I just submitted a report to the CDC of every test that was done in the month of January in the state in a school. And so then that is used to get us funding to continue that program. So that's just an example of something I'm working on.
Okay. So I'm curious to have each of you talk maybe a little bit more about kind of your career decision-making. Either right out of undergrad, or then if you made changes in that career decision, kind of what was that step, and was there anything unexpected or any twists and turns? I know a couple of you are pretty recently out of school, so you haven't maybe had that experience yet. But yeah, just a little bit about the career decision-making process. Okay, go ahead, jump back to you.
I went through nursing school on an Army ROTC scholarship. So I really knew nothing about the military, but it just seemed like a great opportunity. And I thought, I really didn't have any specific plans for after graduation, so why not? And they paid for my, everything. They paid just everything. I mean, I got tuition, I had a monthly stipend, and I also worked through nursing school too. So I just thought it was just fantastic. We went on whitewater rafting trips, ski trips. I had so many experiences just with ROTC that I had never had up until that point, and met just a wonderful group of people that I never would have crossed paths with otherwise. So that was terrific. And then at the time, how they appealed to me, I had played 2 sports in college, and I mean, I knew I wouldn't be able to keep playing sports all my life, but to me, they really appealed to me with the sense of teamwork and be part of a team. And to me, in my mind, I was like, well, this is a way to keep the teamwork going. If not, if I can't keep playing sports, I mean, at least I can be part of a team. So that, exceeded my expectations a billionfold. I just had a great experience. I owed 4 years and ended up staying in for 6. Had a chance to go to airborne school and jump out of airplanes, and nursing experience wise, just had a phenomenal experience. Got so much great preceptoring, mentorship. I worked in a hospital setting, but then also was in MASH units, and spent a lot of time in the field, which I loved. Something that, just the timing wise, when I was in nursing school, the AIDS epidemic had become the big issue. I was in nursing school in the 80s and graduated in 1990. So, I did hear a lot of fear, just what a terrible time to go into healthcare. And, I can't imagine how scary this is. And I looked at it as just the opposite. I'll work on the AIDS unit, let's go. This is why I'm getting into nursing. here's this like terrible epidemic and people are, so vulnerable and in desperate need of great care. Like that's what I'm doing this for. So, I'd say like just the mindset. So I went to the military and, it was just the very beginning of Desert Shield, Desert Storm. And like, oh my gosh, like my family was like freaking out, like, oh my gosh, I can't believe like you might go to like Saudi Arabia or, all these other places. And, but I thought like, I hope so. Like, that's why I'm doing this. Like, if I could be part of a unit and that unit needs me, like, absolutely, that's what I'm doing this for. So, I think, the current situation, I mean, I'm not comparing it to anything by any means, but I talk to students all the time that are going into different healthcare fields. And I tell them, like, what an awesome time to be going into healthcare. And we have so many challenges right now, but what the upside of that is the unbelievable opportunities, for everybody sitting in this room. It's and we'll go into it later, just some of the specific opportunities. But if you have the desire, the compassion, the eagerness to learn and be part of a team, there are some really great opportunities. And I see them every day in HR, in our health system, what's available right now, even with no experience. Like, we'll teach you, we'll train you, we'll send you to school, we'll teach you more, we'll mentor you, just, willingness to learn and to truly help our community and be compassionate and be a positive team member. It can really take you far. It's just, what are your goals and what do you want? So I think a very exciting time. So I know you had asked me why I got out of nursing. So I had, I obviously went to nursing school, had a great experience as a nurse. My last job in the military, I had an opportunity to go into recruiting. So again, I thought, like, I didn't know anything about it, but I thought, yeah, I mean, you think I can do this? I'll absolutely, I'll do it. I'll give it 100%. So luckily the military, they have great training for everything. I mean, anything you do, they're going to send you to training first. So I went to a 2-week course at Fort Monroe, Virginia. At the time, I don't think that that's an active base anymore, but just, learned how, like, just about recruiting. And that was wonderful. So I covered all of Texas and Eastern New Mexico for ROTC and specifically for nursing. So again, just had just fantastic experiences throughout that time I did that. So I got out of the military. I was pregnant with our first child, and my husband stayed in. And so fortunate to have that great foundation of nursing experience. So if anybody I heard we do have a couple of nursing students here. I can't tell you how valuable that is to build that foundation first somewhere, and then, go on to do whatever you want to do, because you never know where your path is going to take you. But if you have that strong foundation that you built right out of school, you're always going to have options. So again, luckily I did have that great foundation. So as my husband moved around, and then we had, 1, 2 more kids later after he got off active duty, I was just able to say, what's our situation right now? How many hours do I need? And, what daycare is available? And I mean, if you have kids, anytime you're weighing in daycare, that's like, is it worthwhile to work? I mean, it's so expensive, and you want to find, we had no family in the areas we're going to. It's like, I don't know these people. So we just made the decision I would work off hours, and we would need as little as possible daycare help. So, so anyway, I was able to say, okay, these are the hours I want to work. These are the days of the week I want to work. So I've got this great foundation. I literally could work anywhere. Let me see what type of positions are available with these hours. So I just always felt such a gratitude that I had this great degree and I had this great experience, that I had the ability to do that. So I worked in different cardiac settings, ICUs, oncology. I actually had some great oncology experience in the military, and worked in those different roles. And then we moved to a very rural part of Mississippi. My husband had gotten off active duty, and we moved to a super rural area of the Mississippi Delta. And I had a job lined up in the ICU, and I could not find a babysitter for our baby at the time. She was our third child. She was about 10 months old. And I just couldn't find anybody that was available starting at about 6:15 a.m. And then I'd be able to pick her up at like 8 p.m. There just was nothing like that in the area. So I thought, I know it's going to work out. I know something's going to work out. So our older two kids were, they were old enough to go to school and had after school care that my husband could pick them up after work. But, it was just kind of getting down to the wire. Well, then somebody had caught on my resume that I had recruiting experience and said, we are actually starting a nurse recruiter position. Would you be willing to just get it started? Because we haven't had the position before. And I said, absolutely. And so I thought to myself, I said, 2 years max, because this works out perfectly now, having normal hours, and, I'll be able to, there are plenty of options for babysitters with normal hours. But I don't want to lose my bedside skills, and, 2 years max. So that baby is now a sophomore here at ISU. And I actually did go back to the bedside last year when, the schools weren't in full swing and my job was kind of slow. I knew we needed help on the floors. So I said, I am terrified, assume I know nothing. It's been like 18 years and here I am. So that was a very rewarding experience. But again, just so grateful. Can't tell you, it's so worth it. Just keep up all the hard work, no matter what you're working toward right now. And just don't ever do anything to jeopardize your degree, your license, whatever path it is. It's just, you'll always be so grateful, especially getting in such a good school like ISU.
Thank you. Wow. Tracy, tell us your path.
Oh, sweet Lord. Okay. So I was the child of a single parent, which means we had no money. So everything I did was always tied to finance. And if we couldn't afford it, you just didn't have it. So I actually came to ISU on a full scholarship. Thank you, Lord. But then I realized after that I actually got into med school, not once, but twice, and couldn't afford to go. And it was at that point in my life, I decided that I will never not follow an opportunity because of either fear or finance. Those are two things that are huge stumbling blocks, and they really shouldn't be part of your decision-making process. I learned it a little late in life. So I went into the laboratory, I love the lab. I know you can't tell this, but I'm a painful introvert. I am. I don't test that way and I don't look that way, but I am a painful. I had to give myself a pep talk just to come down here. So I was in the lab and that was my happy place because I was helping people without actually taking direct care of them. And then I realized I was really good at inspecting and following regulations, and that was really a passion of mine. So I was offered a CAP inspector position where I got to travel to other hospitals and do inspections, and I absolutely loved it. Then I was approached, as soon as I got my master's degree, I was approached to do, it's called a lab plant. It's a very rare opportunity to start a lab from scratch. Ground up, blueprints, hard hat. My favorite thing was my hard hat with my name on it. I was so proud of that hard hat. Yeah, I bought all the equipment, hired all the people. It was the most exciting thing I have ever done. And I couldn't just go back to being a regular person. But you know, the mom thing happened. It happens. And I was actually told I couldn't have kids. So when I had him, my whole life revolved around this little bundle of goo. So I went into PRN work. And if you don't know what that is, it's in any hospital, in any position, they have people that just fill in the schedule every once in a while. So I did a 12-hour shift every Sunday to keep my skills up because you don't want to let them go. And then when I came out of that, I decided I got a teaching degree for high school biology and chemistry. Then I realized I could actually make more money working part-time in the lab than I could as a teacher. I was like, ouch. So I decided that when he went back to school, I was going back to the workforce, and that's how I got into clinical trial research. I wanted a job that was family friendly, that I could own my own schedule, but, and this is a terrible thing to say, but I'm gonna say it anyway. I love to travel and I wanted to travel on somebody else's dime. I did. I wanted to see the world through somebody else's, credit card. That's how I wanted to do it. And I got that. I've been all over the United States. I've been all over Europe, London, Paris, Frankfurt, Amsterdam, you name it, they've sent me there. It's fantastic to fly first class, I'm just saying. So there were perks. There were perks to the thing, and you get all of those travel miles that you get to keep for free. So like when my son and I go on vacation, I don't pay for that either. So it's a good deal. And I'm usually gone for 3 days, out on a Monday, back on a Wednesday, usually twice a month, maybe once a month. But it was one of the things that I wanted to do. At a very young age, I had, my family was military, Army. So you're used to traveling. It's like part of normal life. Staying in one place is not normal. I guess that's the way to put that. So seeing the world was part of what I wanted to do. And growing up poor, that wasn't an option. So when Roche was like, hey, here's your credit card and can you go to Amsterdam? I'm like, yes, I can. Thank you. So I did that. And then, once you get into the field, there's so many opportunities when you get in. Once you get in the door, they just have all these opportunities for you. And that's where they paid for my project management and they paid for my MBA, and they understand that there's only so much they can do salary wise, but they have all of these training opportunities that they can make available to you. And that's why I say, if you want something, don't let finances or fear, thinking you're not good enough, thinking I don't have enough experience. Don't even, if you read the job description and you're interested in it, put in for it anyway. Because right now, all of the healthcare positions, we are willing to train. Everyone is, because we need fresh minds and good ideas. So that's how I ended up where I am.
Brittany?
My story is a little bit different, but both of them gave really, really, really good insights. When I was in my master's program, prior to choosing the field that I'm currently in, I was applying to the CDC. And I remember being a graduate assistant in a department, and all of the professors was like, oh, what are you going to do after graduation? I was like, I'm going to work for the CDC. And I had been applying for a long period of time. And so when it got close to graduation, I didn't get the job. I hadn't even landed an interview. So I was like, man, I got to see what else is out there for me. So at that time, I went on and applied for a social work position. So I ended up working in social work right after graduate school because I was not able to find a position in public health. It was not a lot of people hiring at that time. So my experience was different from Wendell's because he came right out and went right into it versus with me, it was not a lot of positions that was available. So I did consistently apply, stayed in social work. Again, it was still really good experience just working with community, just working with families, working with children, working with law enforcement. It was like a lot of great experience. Definitely long hours of work though, very much so. But it was very rewarding just to work with the families and the children and just, ensure the safety of those kids. But essentially it was not my calling. It was just something that I did right out of college just because I needed a job. So moving forward, I still stayed in Terre Haute as I was working in social work. And then I started having separation anxiety from my family. And so I had wanted to relocate back to Chicago. So at that time, the pandemic had started. So I started looking into jobs, and everywhere I looked, it was new public health positions consistently. So I was like, man, I'm just going to apply and I'm going to move back home. I had wanted to move back home and be closer to family anyways. So once I got applying to a job, I landed a position as a contact tracer. And so immediately I was like, oh, I'm moving home. So I literally gave my notice and moved home within a month. I started a new position as a contact tracer for the Chicago Department of Public Health. So with the pandemic first happening, we were consistently calling and following up with people that had tested positive for COVID. So I worked on a special units for pediatric cases, especially since I had just transferred off of working in social work. So most of my case investigations was revolving around children that had tested positive and families as well. So mainly within our conversation, we would just try to figure out where the infection came from, try to get contacts of who they had come in contact with just to follow up with them, providing resources as well. And then also just consistently getting that data and compiling it to the epidemiologists that were working on those specific cases. So it was consistently a good period of time, and it was great work. But I kept working hard in that role. And once I was in that role for a little bit of time, someone recommended me to apply for my current role. And so within that, I applied for the program manager role and I got it. So prior to me working in vaccine outreach that I am doing as of now, I was working in community engagement. So this was still vaccine outreach for the community, just on a separate level. So with community engagement, I worked with directly community resources. We call them here regional leads, which is the lead in a specific area in Chicago that oversees all of these small organizations to put on events within the community to target and also to kind of vaccinate those areas that are not being vaccinated. So it's just kind of like various levels of community engagement. So we did various outreach events. We did various vaccination events in various places within the city of Chicago. And so everyone wanted to get a vaccination event. So this would be at churches, it would be at community events, YMCA, wherever you could think of, people were submitting to get events done. So we would work with them, put on these events. And now we're kind of demobilizing and not really focusing on events, but more so focusing more on the health equity within specific regions and how we can specifically kind of target those areas and the need within that community. So now I am working on more of the vaccine outreach area, and I love it, but it definitely was a trial to get here. It was not a little walk in the park. When I was finishing with my master's, I was very much discouraged because I couldn't believe it was no positions in public health at that time. So I was just happy that the pandemic did happen because, as you guys mentioned, so many positions opened up to get out there and get your foot in the door. And just imagining being a fresh public health graduate trying to land a position and it's not any, but then COVID happens and you're like, man, I finally get out there. So for me, that was like great experience. And I've just consistently just kind of been going up in ranks since then. And I actually love everything I did to get to this point, and I love everything I'm doing at this time. But I can definitely say you got to keep pushing even when you feel discouraged. A lot of those internships definitely do prepare you for these long-term professions outside of college. So just making sure that when you are doing those internships and those other activities that you're kind of making sure you capture all that knowledge, because it does transfer over into the professional field. So all of that is kind of my little backstory, but again, just keep at it. And again, find something you're interested in, but even so, even if you don't, you can do like I did, try out some other little fields until you get to where you want to be.
Thank you. All right, Wendell.
Hi guys. So I would say that I started kind of questioning my career path pretty strongly about junior year. Before that, I had been a really headstrong like pre-med. And then I went on a voluntourism trip to Ecuador with a group that you may have heard of called Timmy Global Health. They're a extracurricular program that is currently running at ISU. And that's how I kind of interacted with them for the first time. And so I went on this trip and I realized that I didn't want to do one-on-one patient care. I wanted to affect more people. Even if I wouldn't affect them as deeply, I could affect, millions as opposed to like 101. Wouldn't be as significant, but it would be a lot more people. And I decided that was something I was interested in. I also realized that I was not very comfortable with the work-life balance of being a medical professional. I wanted to have more time to travel and to do hobbies and things like that. And also, I didn't think I was in a good mental health space to be attending medical school at the time. So for those 3 reasons, senior year, I decided that I was going into public health. I went back to Ecuador the next year, and that really solidified things for me on like what I wanted to do. And so after that, I applied to a bunch of grad schools and ended up going to UCLA. They had a really nice program, and I studied environmental health science. That means I was looking at like air pollution, water pollution, things like that. For my internship, I was able to go live in China for 4 months and work in a lab at Peking University in Beijing. That was a really awesome experience. Did a lot of traveling as part of that as well. And then I came back and it was my last quarter and I was taking a class. I'm sorry, it was my next to last quarter. And I was taking a class called Infectious Diseases and Their Control. And that was a epidemiology course. I just took it because it sounded interesting, not because I needed it. And then this thing called COVID started right as I was taking that course. And the guy that was teaching this course was literally the former head of vaccination for the WHO. So he knew what he was talking about a lot. And so he walked us through every time we would meet, the class just became following COVID and talking about how we should be acting in this moment with this amount of information, lockdowns, what we should be doing, the pathology of it, like all of this stuff. And I kind of fell in love with it. And so I was like, man, maybe I should go into epidemiology, but I really like environmental health. I don't know what to do. And so then before I even graduated, a recruiter on LinkedIn reached out to me. So keep your LinkedIn profiles updated. And was like, hey, would you be free to talk? So we chatted, and then they said it was for the Wisconsin Department of Health Sciences. Well, that was great because at the time I had moved to Wisconsin because my partner, who also went to Indiana State, is a grad student at UW. And so I was living here and finishing school remotely. And so I was like, oh, really? I need a job in Wisconsin. This is perfect. And so interviewed, they were desperate for people because, yeah, they had nothing, like no infrastructure set up for this type of response in this scale. And so I became an epidemiologist. So that was my second career change. So I did that for over a year of just like all of the guidance you can think of, talking to medical professionals and other epidemiologists and telling people they couldn't get on a plane and all kinds of stuff. And then I transitioned within the Department of Health Services in what equated to be essentially like a promotion. And so now I do data analysis. And so it's kind of like the other side of epidemiology in a way. I'm doing like the data stuff instead of like the people stuff. And I'm really enjoying it. My day-to-day is I sit at home. I'm 100% remote. I can work anywhere in the US. So I can travel wherever I want, whenever I want. It's really nice. Like I'm going to Los Angeles to see some friends in a month and I can just work there, for example. So that's really nice. Yeah, so I just put in 40 hours and now I am officially a state employee instead of a contractor. One thing I will say is with government jobs, in my experience, very much about getting your foot in the door. Once they meet you and know you, it's a lot easier to move up as opposed to just like applying for a higher level position. So if you're interested in government work, in public health or anything, I would recommend like straight out of school, just like going for it, getting your low level job there and then working up. And I'm happy to take any questions.
So what, anybody have questions for them? Just need to speak up so they can hear you.
Are you guys doing any internships like as of right now, like in the summer or like during spring break or anything like that? Like if you do, like where would you apply and like what are the competitions like basically?
We have Peg from Union. We do have internship opportunities all the time. If you'd like to email me, I'll email you the link. I feel like it's a little hard to find on our website. So I'm happy to email the link to get you right to the application for an internship. With a few exceptions at Union, our internships are unpaid, but we do have great internship opportunities throughout the system. The exception that I spoke about earlier is in our IT area. They do have some paid internship opportunities in IT. I don't know like if that's right now or in the summer, but our internships are really individualized to kind of meet the needs. Like we have different students that need different hours of internships, working in different areas. You know, as long as you're flexible and you have an idea of what departments it is that you would like to do an internship, we'll do everything we can. That's managed through our volunteer services department. But again, the first step would be just applying, and I can send you the link to that application. What area are you interested in?
So I'm a chem major, so basically like I kind of want to merge out like as work as a lab.
You need to come talk to me.
I just like I actually enjoy working in a lab because it's like I have my own little place and like to do experiments and stuff like that because I'm always curious about stuff. So like if there's any chance that I can like work in a lab for forever, I would definitely.
And I would say, we won't send you to Amsterdam. So I would
Oh, come
send you to
on.
this girl. But the lab is an area that we've got an enormous amount of opportunity with at Union. We recently, we had been contracting our lab services through LabCorp, and we recently ended that contract and then started our own lab within our health system. So there's just tons of opportunity there and a real good team. We've got a world-renowned consultant there right now that's staying for a year. She's amazing, a great resource and person to learn with too. If I were you, I would actually try and get an internship with her. Just phenomenal, but I can give you more information. But again, it's not Amsterdam. Yeah.
I had a head cold from the stupid plane. So Roche has a very large internship program, actually. They all start in the summer, but depending on what you go for, they are for different lengths of time. So if you want one just for the summer, we have those. We have them up to 1 year. I think we had one that was 18 months, but those are usually paid. And then they don't say this to your face, but the expectation is that you will work for us when you're done. I mean, if we're putting 18 months into you, we kind of expect a little something back. But yes, we don't have as many internships as we used to. I would say we're probably down about 30% just because of the workforce is working from home now. So it's a little hard to intern when nobody's in the building, but we do have lab internships because our lab is still.
And Wendell and Brittany have both shared a link for internships where they work, and we will get those to you too.
Yeah, I put in the one for the Indiana State, not Wisconsin.
Okay,
That
all
might be more useful. I can say, so actually one of my coworkers was an intern for Wisconsin Department of Health Services before he graduated and then turned around and worked for them. So that is a good way to get your foot in the door. There are so many internships available. They're just kind of hard to find sometimes. I literally remember one day working, I was on an inbox for people to ask questions about COVID, like, do I need to isolate? That sort of thing. And I got an email from someone, they may have been a high school student, that was just like, hi, I've been looking at this. I'm very interested in your work. Can I be an intern? And I was so impressed by the audacity of someone to just like email a random email that they found, that I sent it to my boss. And I think that person may have gotten an internship. So don't be afraid to like essentially cold call people and say that you're interested in their work and ask.
And I can second that, Wendell. We definitely have internships as well. And a lot of our interns work directly with whomever they are placed with, whether it be the program manager, the epidemiologist, the public health administrator. You work directly with them on whatever project it is. And it's typically throughout the whole semester. I know now, even though it is in Illinois, there is a lot of remote options just due to, COVID has opened up so much. So there are a lot of opportunities to work in various areas, whether it's homeless shelters, any of those congregate setting locations. It's a lot of opportunity as well. So it's definitely good experience, and it kind of gets you to kind of build connections within local facilities that you're interested in.
What other questions do we have?
Good question for Tracy. So whenever you got your master's, what was the job that you did before master's versus like after? Did you work during your master's part-time?
I actually worked full-time. That's a whole can of crazy. I don't recommend that, but finances being what they were. Well, so I think I mentioned that I didn't pay for any of my education. So when you get into hospitals, corporations, they have tuition assistance. So as long as you're putting in your 40 with them, they are more than willing to pay for your education. I did mine on evening shifts. I went to school all day. I went to classes in the evenings, I think 5 days a week. It was a very long time. And then, yeah, I got my master's that way. And it was really weird because the company that I worked for at the time, they gave you X amount of dollars per annual year. So I would go to classes until that money ran out. And then I would wait until the next year, and then I would go to classes until the money ran out. So it took me a little bit longer to get mine, but I got it debt free. So there's always that. But yeah, it's somewhat difficult to work full time and go to school. If you have kids, it's almost impossible. You have to. I actually had my son right as I was graduating my master's, so I got to carry him everywhere, and nobody said anything. So just kept him in there. Did that answer your question? So can I just address something I think Wendell had said about, I think, Wendell, did you say about getting your foot in the door? Was that you? Okay.
Yeah.
So in the world of clinical trials, and with all the, if you want to go corporate, they always have contract jobs. I highly recommend the contract jobs. First of all, if you don't know if you want to do it or not, it gives you a definite end date. Without the penalty of being like, yeah, I quit because it stunk or I wasn't good at it. You don't have to explain it. You're like, the contract ran out and I did something different. So you don't have to worry about that. You can try, it's kind of like trying your job on. You get a contract for, I don't know, 18 months, 2 years, whatever it is. You do it for a little while, you decide if you're good at it or not. And the corporation, if you stay on and you finish your contract, more than likely that's the easiest way to get a full-time position. So think about that when you're doing job searches. Contract work, and also I think somebody said they were wanted to be a traveling nurse. I can't remember who said that. But you know, you can sign. There's traveling labs, so you can see the world, and you can. There is a lab in Hawaii. I do not make this up. So you can do these contracts for these short-term assignments and travel, and then you know when you get bored with that one, you just go to the next one. So it's kind of a good way to try on a bunch of different careers until you find the one that feels good, that fits right. Thanks, Wendell.
This is kind of a broad question, but when it comes to searching for public health jobs in particular, I feel like it's very challenging to type in like public health internship, public health career. and it's just a super broad field. And I guess a question we ask a lot in our GA office is kind of what more specifically to actually put into our search bar to generate more directed towards public health careers, I guess.
If I, Brittany, I would imagine you and Wendell have a lot of expertise on this. I would just like to throw in, maybe consider population health also. We recently transitioned to the population health model at Union at great risk because it seems counterintuitive, but our mission is to outreach to the most vulnerable community members that we have in the area and keep them out of the hospital. So when I started at Union 6 years ago, there wasn't even a department called population health, and now there is, and it's grown exponentially. So we have nurses, therapists, social workers, pharmacists, like this whole big team that will actually go out and outreach to vulnerable community members that we've identified. So, and it could be anything. I mean, with that diverse team, it could be addressing any number of issues that patient has going on. So, maybe that's just something to kind of keep an eye out for, in addition to, I'm sure Brittany and Wendell and Tracy has some
I
great
don't.
insight in
Yep,
that too.
nope.
That would just be, when you asked about that came to mind. Like, I wouldn't have heard about that before it started at Union.
Brittany,
I'll
wanna
just,
go?
yep, I was gonna say, I'll come off mute to answer that because that's a lot to type. So to China, in response to the question, how is it living and working in the Chicago metropolitan area? And just kind of getting a little more information in regards to that, especially with of high crime rate. So currently it is really good living here. And I would say, of course, it is crime, but it's crime in every city. We have been seeing, obviously spiked interest of people moving here, especially students, because of the things that are offered within the universities and various other things here in the Chicago area. I would just say that it's all about, and this is even for me being a Chicago native, it's just all about being aware of your surroundings, no matter where you go. And, knowing, I would say, just because when you're in a profession and you're working usually your regular schedule, you're commuting, you're still in an area where, depending on what time it is, you're still out there trying to see, what's going on. So you are still being aware regardless of anything when it comes to crime rate, wherever you are. But I would say, as far as the job opportunities, it's a lot of opportunities. It's really good. The lifestyle of just enjoying yourself as a student or as a working professional, as far as like gatherings and social events, is still really, really nice. So even though there is concerns of high crime rate, there are other various beautiful things to be happy to see here within the Chicago area. I know a lot of professionals that are here that still enjoy it, and a lot of them are not from here, but they do enjoy the various things here. So I would say it's still really good here, and I would still recommend it. I would just say, if you are interested in relocating, just make sure that you are researching the community in which you're interested in moving into. Also look and see the commute from where you're going to how far to be going to work. That's always something you want to be interested in, just because traffic. Me moving back home, I just really thought how driving on the weekends to Chicago was just going to be like a straight through. And sometimes I'm sitting in traffic like, oh my gosh. So also take in consideration that too, just moving to a big city as well. So I hope that answers your question.
Going back to the question about how to, like, what search terms to use. There's never a good answer for this. But to be honest, I think the best way to do it is to go to whatever state you're interested in. And so in Wisconsin, it's wiscjobs.gov, or in Indiana, I'm sure it's like workforindiana.gov or something. And so then you just click all jobs. It'll pop up every single job in the entire state of Indiana, filter it by the Department of Health, and there's all the job titles. And it's essentially brainstorming for you. And so, oh, epidemiologist, oh, they call it, this job title. And so then you can go use those names of those job titles, search them, and that really helps usually. And so it just gets you familiar with the terminology and the titles of all the different positions. And you can also, each job will have a little job description. So you can see if that's a job you might be interested in and would want to continue searching. So I think that's a good way to kind of have like a word bank essentially of search terms.
So I have a question for Wendell and Brittany, just about, and I know you can't project into the future, but when COVID has calmed down, where do you think what do you work on next? I mean, hopefully there's not another pandemic for you to work on. And I know for both of you, that's been really fantastic. I mean, it's been ironic that you found a place. What do you think your next project will look like?
I can answer that question because we're actually working on this as of now. So right now it's focused on health equity. So it's a broad range, but we are focusing on violence prevention. Obviously, since the conversation has come up, we're also focusing on HIV, STI. We've had a couple different outbreaks in various areas within Chicago. So we're working with our community leads to figure out what's the concern within their community. And then we're going to put on various educational events to kind of target what's the concern within that community. So as we're kind of demobilizing from the whole vaccine side, we are kind of focusing on the health equity portion. So it is various different communities that are, coming up with various things that they're concerned with within their community and kind of how we can target it. Right now, we're doing a lot of health outreach for various concerns. We also do a lot of canvassing to kind of figure out what's the need within the community, or even just to make conversation with those community members and kind of build a rapport. Because in most cases, the canvassing team provides more information to us within the office of what's going on. Like, hey, this is what community people are telling us is going on. Hey, this is what the concern is. Whether there is concerns of drug abuse, where there's a concern of obesity, we just kind of target all of it. So we're kind of focusing on specifically one dynamic focus across the board for all of the Chicago region in regards to health equity.
And I can add to that a bit. Yeah, so it seems like we're done. We're just getting started. So one thing of import is that it seems like public health as a field will have a lot more funding in the future than they did before this pandemic. People realized, people being, the people that make these budgets, realize that maybe they should give us a little more money so that we could prevent things in the future rather than react to them. And so that is something that gives a lot of hope to people that might be coming into the field of public health. That said, as Brittany said, going into health equity and that side of the pandemic response is a huge priority. And also just kind of debriefing what exactly happened in the past 2 years is going to take a long time. There's so much research that can be done into this. We have to go and look at all of our data and see, oh, how could we do this better in the future? And that sort of thing. And I hear this in meetings way too often, but we're building the plane as we fly it. And so the idea is once we land that plane, we can see how we built it and hopefully build better infrastructure. Because we're inventing things right now and they are very thrown together. And so it'd be nice if we could have those as permanent, reasonable fixtures. So one example is right now, we don't know how many therapeutics are in the state. We have a decent idea, but we don't have a concrete level idea. And so we're building a way for hospitals to report specific drugs to treat COVID, how much they have at any given time. And that will obviously carry on into the future past COVID. So that's one example.
Yes, ma'am, go ahead.
Hi, my name is Samantha Lofu, and I'm a biology major. My question is, to piggyback off of what he said earlier about internships, when do you recommend a student to do an internship during school time, or like you guys said, it's available in the summer as well? And are internships available on weekends?
If I could start, our internships are always available. So you could really apply anytime and we'll try and meet your need. Weekends are available depending on who you're interning with, if they're working weekends. So that really is more role dependent and what department or what professional your internship is with.
So we have internships year round, but we actually have an open window and it starts in March. So if you want a summer internship, those process starts in March, and then you will know in May, before you get out of school, if you have an internship over the summer, and then how long that will last. We do not have interns over the weekends. You're welcome.
So for us, it can really vary, like a lot, and it depends on your project. Sometimes you'll be given a project and it's like, here's a deadline a month from now. And so if you want to work on it on the weekend, I mean, that's your prerogative. We don't tell you when to. And so it's very much a case by case basis, and you would just have to talk with whoever your like contact person was.
I would say the internships are typically available per semester, and then also summer terms as well. Most times, our internships open up per semester as to what's available, as they're trying to stay on the school schedule. But if you want to do something outside of that, then I would always just recommend seeing like what's available to do something on your own, because you can still gain the experience of an internship, although it's not through your schooling or your class specifically. So I did internships over the summertime just to kind of gauge my knowledge. But again, if you don't have to, then, you can kind of think of it that way. But I did have to pay out of pocket to do those internships if I, wanted to do it outside of my classroom style, because it's like you can kind of take up the class, but again, depending on if you need it or not, you're just kind of coming out of, more financial money if you don't need it. So I would just kind of recommend just kind of trying to take your classes or take your internship specifically within that class period or class time. So if it's in the summer semester, then make sure it's for a class or something. But if not, you could possibly have to come out of pocket to do something outside of that.
One thing I'd like to add is that I did the SURE program. I'm sure you hard science people will recognize that term. I did that every single summer. And it helped me quite a bit, I think, moving forward. Your internships are going to decide your career path a lot more than you might think. And so spend time on them and try to do them if you can. And especially if you can find a paid internship, like SURE, that kind of helps offset things. You might not get as much money as if you worked at the job you had in high school or something, but it pays off big time, usually. And so I was a chemistry and biology major, so I know what a couple of you mentioned you were as well. And I know that the SURE program made a huge difference in my acceptance into grad school. Public health is such a broad field that you by no means need to have a hard science background to be in public health. But the specific person I was applying to work in her lab, she was very happy that I had a chemistry and biology background because I was doing air pollution work, which is, one small part of public health, but it's a more technical part of public health. And so she loved the fact that I had those backgrounds and that internship experience. So that really helped me get into grad school.
I think we're probably gonna let our Zoom friends go. And let people, I know that people are starting to pack up a little bit, so whoever needs to go can go. Wendell and Brittany, and Peg and Tracy, would you be okay if we shared your email?
Oh, definitely.
Like if
The recruiter's like, no, don't give it.
Yes, and then, if I can answer a question I just saw pop up,
Oh,
asking
sure.
if we have an RN residency program. We absolutely do at Union. It's a year long, and every new nurse is automatically embraced into our residency program at Union. There's no separate application. Everybody's included in on it. And we have an 11-person nurse educator team, which is like phenomenal. I've never worked anywhere
gonna
that
say
has
that's a
more
lot.
than like one or
for you.
two. Yeah, we have 11. And so every single area of that's like clinical at Union has a nurse educator supporting that area. So they're just a great wealth of information. They're experts in their areas, and they're just great people. They really enjoy teaching and sharing information. So our nurse educator team facilitates our residency program. And a new nurse would be in orientation with our nurse educator team for the first 2 weeks, and then go to the unit where they're going to be work one-on-one with the preceptor. But then every month for that first year, for a whole day, they're meeting back with the nurse educator team and all the other new grads that are in that residency. And it's a fantastic curriculum that they really fine-tuned based on evidence-based research and best models of practice. And it includes all sorts of things, all sorts of set curriculum for part of the day, but then breakout sections that you can select based on your interests. So if you're working on med surg, but you think, I kind of am interested in labor and delivery, but I'm really not sure, you could pick labor and delivery breakout sections and have exposure to, learning more about labor and delivery. So that's just an example. Again, it's for a year, and it really is just a great umbrella over our nurses. And again, if not Union, I would really encourage it. How many nursing students do we have in the room? Okay, yeah, if you can start somewhere with a residency program and really take the time to interview at least a couple places to say, can I see myself here for a couple of years to take advantage of every single resource this facility has? Like, I want it all, because you'll never get that window of time back again that you have as a new grad nurse. And then, I'm sure a lot of other majors also, but nursing especially, just all of, how complicated some of the nursing units are, and the patient load, the critical thinking skills, that all starts with building that good foundation and having all the support you could possibly have. So I would definitely, that was a great question about the residency.
I think, we could obviously ask questions all night. I have questions. But I think, and I think Wendell had kind of alluded to this earlier. I think the four of them would be very happy for you to reach out, continue asking your questions, perhaps link with them through your social media, through LinkedIn. But Wendell alluded, earlier in the session, just take a chance and ask someone. And that's how a lot of these internships in particular are found. They may never be posted, ever. A lot of internships aren't posted because they're not even sure they need one. If you reach out to a hiring manager, or you reach out to someone in that department you're interested in and you ask about an internship, sometimes they'll create one, or they'll find one, or they maybe just didn't advertise it. So being proactive really does work, and it does help. So I would encourage you to stay in touch with our four panelists. And I want to thank them so much. Thank you, Wendell and Brittany, for being online, and Peg and Tracy for being here in person. And again, I would just encourage everyone to kind of keep in touch, keep your network going. So yes, I hope everybody has a wonderful night. And you're all welcome to stay here if you'd like, and eat and chat. And I think we'll say goodbye to our people online. And thank you so, so much to Wendell and Brittany for joining us tonight. Yay. I'll be back in touch with you guys tomorrow, okay? Thank you.
Good luck, all.